this weekend I had, I think, an incident that is illustrative of the problems, or one of the problems we have in modern medicine. And that is overutilization of services and very little desire to attend to the needs of patients. Let me give an example. There's a patient had a total knee, meaning they had a new knee put in. Patient's in their early 60s. All of a sudden, the incision started draining. The area got red, and at the same time, however, the patient developed a fever. It turns out that their chest x-ray was positive for pneumonia, and they had a pneumonia, but whether or not indeed they might have had an infection in their leg is being assessed at the very moment I'm doing this recording. Having said that, it was a couple of days ago. I called up the surgeon who was covering for the orthopedic surgeon, the bone surgeon, who did the procedure. And that doesn't mean that the surgeon did anything wrong. These things happen, especially in hospitals. But having said that, the doctor said send them to the emergency room. Now, sending to the emergency room is a considerable cost to society. Imagine that happening thousands and thousands of times in a day, and think about the average cost being maybe $4 or $5 grand just to take care of this patient and look at their knee. Doesn't mean anything else will be done. Now, I said to the surgeon, why not have the patient seen by you? Why can't you come into the skilled nursing facility that I was in? Or, for that matter, can we at least arrange for the patient to be seen the next day, which was Monday? This was Sunday. He punted it off until Monday rather. He asked me not to do any antibiotic therapy, certainly for the knee, because that would make it harder for him. He wanted to observe it. And he punted to the surgeon who did the original surgery, not the covering surgeon. So the next day we called that office, and surgeon didn't get on the phone, didn't even talk to me. Busy in surgery where they make a lot of money. By the way, orthopedic surgeons are, on the average, the highest paid physician in the United States. And the office staff explained to me that the patient, again, should go to the ER. No concern at all for the cost of care. Now, let me explain to you that being in the emergency room does not mean that it's better care. Tons of useless tests, waiting for hours. This was something that they should have seen in their office, and they didn't do it. This is a problem with U.S. medicine, and I don't think it's going to get better by free trade, because there is no free trade. Patients don't know that the doctors are doing this. The doctors are not competing with each other. And when I told this to the office staff, they could have cared less. They were indignant. I never got to the doctor, by the way. I asked for him to call me. He never did. We have a big problem in medicine, whether it's the Affordable Health Care Act, which I'm not in love with, or maybe we need a much better kind of control over health care. The costs are getting worse, not better. And this kind of care, which is 10th rate in my opinion, is still proliferating in our society. It's terrible. Shame on the orthopedic surgeon.